Welcome to our podcast today. I am your host, Professor Lanti Creer. I am a senior researcher as well as an academic within the Faculty of Health Sciences here at the Northwest University. I am also the program leader for one of our postgrad studies presented here at our research unit. The Africa Unit for Transdisciplinary Health Research is currently offering the master's degree in transdisciplinary health promotion, which is the only research entity in South Africa presenting this master's degree. Health promotion is the process of enabling people to increase their control over and to improve their own health. However, health promotion becomes even more powerful when we approach it via the lens of transdisciplinarity. Transdisciplinary health promotion integrates knowledge from various disciplines, such as biology, education, psychology, communication, and even environmental sciences, to encourage people to voluntarily change their own behavior. This is achieved by using targeted health promotion initiatives with the ultimate aim to improve health, prevent diseases, prevent disability, and later premature death. South Africa has a unique health landscape and unique health-related challenges, especially when it comes to how communities understand health and how initiatives for health promotion should be implemented, considering each community's unique needs and challenges. The ultimate goal is to co-create implementable, contextual solutions for health and later on adoption of these initiatives by the communities. Now let's turn to Arehone, who will share a bit of her experience during the course of her studies. Welcome, Arehone.
Thank you. Thank you for having me.
Tell us a bit about your undergrad studies, a little bit of your educational background, and why did you choose to pursue this degree in transdisciplinary health promotion?
So for my undergrad studies, I did a degree in medical sciences. And my reason for doing that was because in grade 12, I really loved biology. And when I saw this degree being shown to me, I was like, okay, let me choose to do this, and without proper knowledge of what it is really. And then immediately after completing my undergrad in medical sciences, I decided to pursue an honors in clinical anatomy, specifically measuring in neuroanatomy. And after that, I was like, let me go work, because I'm not really sure what I really want to do. And then after 4 years of working, I decided I need to go back and do a master's, and it needs to be something in health sciences. So I was asking around, then I spoke to a colleague of mine who told me about transdisciplinary in health promotion. I knew nothing about it. She's like, oh, I'm doing this course at this university. Maybe you can try do it. And I was like, I don't even know what that is. Then I Googled it, and from the little knowledge that I saw or that I got from Googling, I saw that transdisciplinary is basically an integration of knowledge or perspective from different sectors, different disciplines to solve a complex health problem. I still didn't know much about it, but I decided, let me go and apply for this so that I can learn more about it, because it seems interesting. So that's basically how I landed in a master's in transdisciplinary in health promotion.
Tell us a little bit about your research topic and why did you choose that particular research topic?
Together with my supervisor, we came up with the topic, health promotion strategies used in BRICS country to reduce neonatal mortality. So I found that interesting that we're going to explore strategies which are used in these countries to reduce neonatal mortality. And I found that to have a link with what I'm already seeing in the hospitals.
Tell us a little bit more about the skills that you acquired during the course of your studies?
One of the skills that this master's taught me was to be a critical thinker, like to be open-minded, like not looking at health challenges on a surface level, to know that there's different factors that may affect, that may lead to a health problem. You know, like it can be an economic problem, it can be an environmental problem, or even a cultural problem that may lead to certain health outcomes. So it helped me to be a critical thinker in that way. And one other skill which I really appreciated from this course was that I learned that there's actually a research methodology called a scoping review. I always thought it's either quantitative or qualitative methodology. So this showed me that I can actually use existing literature and just learn from the existing literature. So yeah, those are the key skills that I learned from this master's study.
Tell me, what is your biggest takeaway from this qualification?
So my biggest takeaway from this course was learning about health, and actually, you know, dissecting the word health and knowing what factors influence health. Like I was at first, I didn't think factors such as your economic background, factors such as your environmental background or where you stay can influence health. But from this course, I know that all these social determinants of health can essentially affect your health outcome. And addressing these health outcomes needs a collaborative approach to do so.
And lastly, if you could do something differently, what would it be and why?
So I wouldn't really change much about my research study, but I'd just like to now explore from a physical point of view. You know, I was using existing data to see what strategies exist. So what I would do differently, I would just like, you know, would want to physically go to hospitals and just like to find out what strategies did you use to reduce neonatal mortality, you know, and just do a comparison using actual physical data, maybe through interviews. But all in all, it was actually good learning from existing literature to see what's out there. But right now, I would want to actually physically go to the hospital and hear from people.